Hello my dear friends. Today we are going to discuss about the new topic. It's neoplasia. It's very interesting chapter from the pathology. The most important portion from the pathology. So we go here. The neoplasia. Neoplasia refers to the process of new growth. Oncology is the study of tumors or neoplasms. Cancer is a generalized term used for all malignant tumors. The common feature of all neoplasms is uncoordinated growth of the tissue persisting even after the cessation of the stimulus which evoked the change. The tumors are usually composed of the parenchyma made up of proliferating neoplastic cells, stroma made up of connective tissue and blood cells, and the desmoplasia is a term used for the stimulation of abundant collagenous stroma by the parenchymal cells. The benign tumors. These are usually denoted by adding a suffix "oma" to the cell of origin. So these may be arising from fibroblastic cells, cartilaging cells, or osteoma. And the cartilage cells which are affected are known as chondroma or the osteoma. What is adenoma? The adenoma means the benign epithelial tumor arising from glands or forming a glandular pattern. The papilloma, benign tumor. Papilloma means the benign tumor arising, the benign tumor with the finger like projections. Polyp, tumor producing a visible projection above a mucosal surface protruding in the lumen. So my friends, please remember the benign tumors. These are usually denoting by adding a suffix "oma". Even not the benign tumors, the like sarcoma example. For the malignant tumors are also there "oma" ending with the suffix "oma". So to the cell of origin. So these may be arising from fibroblastic cells, fibroma, the cartilage cells, chondroma or osteoblast, osteoma. And the benign tumors are having the different types. There are adenoma, papilloma, and polyp. In adenoma, what is adenoma? It is benign epithelial tumor rising from glands or forming a glandular pattern. What is papilloma? It is benign tumor with finger-like projections. What is polyp? It means the tumor producing a visible projection above a mucosal surface protruding in the lumen. So my dear friends, please remember it. So the next important major topic, the cancer. It's malignant tumors. These tumors can be of the following types. They are, the first major one is sarcoma, arising from the mesenchymal tissue, and the carcinoma tumor, which are the tumor of epithelial cell origin derived from any germ layer. If this tumor is having a glandular pattern, it is called adenocarcinoma. The sarcoma, which is arising from mesenchymal tissue, and the carcinoma, tumor of the epithelial cell, origin derived from any germ layer. If this tumor is having glandular pattern, it is called adenocarcinoma. And the major important factors about this sarcoma and carcinoma: the divergent differentiation of parenchymal cells produces the mixed tumors or pleomorphic tumors. In teratoma, parenchymal cells are made up of from more than one germ layer, example dermoid cyst. Choristoma is the ectopic rest of normal tissue. It means that the normal tissue is present at a different anatomical site in the body. Hamartoma is a mass of disorganized but mature specialized cells indigenous to a particular site. It is formed due to the abnormal differentiation. The characteristics of neoplasia is the most important, the major part. The first one is anaplasia. This is the hallmark of malignant transformation. The extent to which the neoplastic cells resembles normal cells both morphologically and functionally is called differentiation. An absence of differentiation is called anaplasia. The features of anaplasia include pleomorphism. It is the variation in the size and shape of the cells. Hyperchromasia, increased nuclear material or DNA, is responsible for dark staining of the cells called hyperchromasia. In normal cells, the nuclear cytoplasmic or ANC ratio is 1:4, whereas it becomes 1:1 in anaplastic cells. Increased mitosis gives rise to atypical bizarre mitotic figures. Loss of polarity due to disturbed orientation of anaplastic cells. Presence of tumor giant cells having big hyperchromatic nuclei. Dysplasia. The important definition: dysplasia is characterized by the abnormal proliferation of the cells, which also exhibits pleomorphism. It is a reversible condition having intact basement membrane. It is not cancer but can give rise to the cancer as it is a pre-neoplastic lesion. So it's most important point. Dysplasia is the most important point. When dysplastic changes involve entered thickness of the epithelium, but the lesion remains confined to the normal tissue, it is called carcinoma in situ. When the cancer cells move beyond the normal tissue, it is said to be the invasive. And about the rate of growth, the growth of the tumor correlates with the level of differentiation. Well differentiated tumors have a slow proliferation rate. Usually, the 10⁹ cells produce a clinically detectable tumor. And the third, local invasion. It is the second most reliable feature that differentiates malignant from benign tumors. The benign tumors are slow growing, cohesive, expansible. Masses that are usually capsulated. The malignant tumors show invasion, infiltration, and destruction of the surrounding tissue. The fourth most important is metastasis. It is the most reliable feature of a malignant tumor, characterized by the spread of the tumor to other parts because of penetration into blood vessels, lymphatics, and the body cavities. Almost all cancers can metastasize except glioma, malignancy of central nervous system, and Radon ulcer or basal cell cancer of the skin. Pathways of spread: direct seeding, involvement of peritoneal activity in ovarian cancer. Lymphatic spread, usual for carcinomas, pattern of lymph node. Involvement follows natural route of lymphatic drainage. And avoiding hematogenous spread, usually for the sarcomas. Thinner walls of veins causes preferential venous invasion in comparison to arteries. So here please listen about the genetic predisposition to the cancer or inherited cancer syndromes. The major one, the first point is autosomal dominant cancer syndrome. In this, inheritance of a single mutant gene increases the risk of development of cancer. Can be remembered as very charmed and nice men have lots of female friends. So it's a mnemonic. So I can explain here in the next page. It's rich and means retinoblastoma. Nice means neurofibromatosis 1, 2, avoid basal cell cancer syndrome. And the men means melanoma, men multiple endocrine neoplasia 1 and 2. Have means hereditary non-polyposis colon cancer. Lots of denotes Liefromini syndrome. Female means ovarian and breast tumor. Will occur in females obviously. Friends denotes familial adenomatous polyposis. We go for the familial cancers. These are cancers occurring at a high frequency in families without a clear defined pattern of transmission. These usually show early age of onset and are present in 2 or more close relatives of the index case. Include cancer of colon, ovary, breast, pancreas, etc. The third major point is autosomal recessive cancer syndrome of due to the defective DNA repair. Defective DNA repair increases DNA instability, increasing the chances of development of cancer. Bloom syndrome, Fanconi anemia, ataxia, telangiectasia, xeroderma pigmentosa. So if you want, you can remember with like mnemonic big facts. Big means Bloom syndrome, F means Fanconi anemia, A means ataxia, telangiectasia, X means xeroderma pigmentosum. Precancerous conditions or non-neoplastic conditions associated with cancer include endometrial hyperplasia, chronic gastritis, leukoplakia, ulcerative colitis, and solar keratosis, etc. So the carcinogenesis, it is a multi-step process which requires accumulation of multiple genetic changes either as germline or somatic mutations. So we are going to discuss about it in the next. The mutations: action of proto-oncogene, inhibition of tumor suppressor gene, affect genes regulating apoptosis. Proto-oncogenes. So the main point is proto-oncogenes. These were discovered by Harold Varmus and Michael Bishop. They are the normal genes required for cell proliferation and differentiation. The proto-oncogenes get changed into genes promoting autonomous cell growth in cancer cells called as oncogenes. The protein products from the oncogenes are called as oncoproteins and they promote cell growth. And here is the chart which represents all the major categories. GTP binding KRAS point mutation which affects associated with the human tumor, colon, lung, and pancreatic tumors. So please listen to this table and you can copy to your notes about the major proto-oncogenes and what's the categories: proto-oncogenes, mode of action, associated human tumors, from this chart on the screen. Please note right. So the activated RAS binds to its farnesyl transferase receptor, promoting mitogenesis. The activated RAS comes back to its normal and active state due to the intrinsic GTPase activity, which gives augmented due to a group of proteins called GTPase activating proteins, or GAP. Mutated RAS proteins bind to GAP without augmentation of GTPase activity, resulting is uncontrolled mitogenesis and tumor formation. So please note, neurofibromin protein affected in neurofibromatosis is an example of GAP whose mutation results is neurofibromatosis 1. The different types of RAS affected in different tumors are: KRAS is affected with colon, lung, and pancreatic tumors. The NRAS means it's affected with melanoma, blood tumors, AML. The HRAS means bladder and kidney tumors. Here we go to the next second type, ABL. It possesses non-receptor associated tyrosine kinase action. CABL present on chromosome 9 fuses with the BCR gene on chromosome 22 and result in Philadelphia chromosome 922. The fusion gene possesses uncontrolled tyrosine kinase activity responsible for causing cancer development. MYC, it is most common nuclear transcription regulator affected in the human tumors. Uncontrolled nuclear transcription give rise to development of cancer. The absence of growth factor MYC can cause apoptosis. This is known as conflict model. The types of MYC include CMYC, Burkitt's lymphoma, LMYC, it's small cell lungs cancer, NMYC, neuroblastoma, and for neuroblastoma. And this next one is tumor suppressor genes. These genes normally regulate cell growth. They do not prevent tumor formation, so the name is called as misnomer. Any failure of growth regulation causes development of cancer. Some important tumor suppressor genes include RB gene. It was the first tumor suppressor gene to be discovered in the active or hyperphosphorylated state. It is present in the non-multiplying cells. So my dear friends, please check out the important tumor suppressor genes. Please note down all this chart because it's very most important and helpful for the exams. So please write down the chart here you can see from the screen. So please note it down and repeat it carefully and watch it carefully. The oncogenic viruses. The oncogenic viruses cause phosphorylation of RB resulting in its activation. The RB inactivation results in cell multiplication. Oncogenic viruses cause inactivation of the RB. RB means activated phosphorylated state, and the RBP, inactive phosphorylated state, causes multiplication of the cells. In that sense, two-hit hypothesis According to this hypothesis, both the normal alleles should be inactivated for the development of retinoblastoma, and the retinoblastoma can be of the following types: inherited familial retinoblastoma, which is 40%. The first heat is inherited and present in all somatic cells, whereas the second heat is seen due to point mutation in the retinal cells after the birth. It is also associated with increased risk of osteosarcomas. And what about the sporadic retinoblastoma, which is having 60%? Both the mutations in the RB gene are acquired in the retinal cells after birth. The neurofibromatosis 1 and the type 2 gene. Neurofibromatosis 1 first gene gives the rise to neurofibromin, which is GTPase activating protein GAP. The neurofibromatosis 2 gives rise to neurofibromin 2 or myelin protein, which inhibits the proliferation of Schwann cells. So any mutation affecting any of these genes increases the chance of development of cancer. The p53 gene, it is also known as molecular policeman. Please remember, p53 gene, it is also known as molecular policeman and guardian of the genome. It is the most common gene mutation in human cancers. The T gene is present on chromosome 17p. Any inactivation of p53 prevents successful DNA repair in a cell, leading to the development of a tumor by the above explained mechanism. It can result in Lee-Fraumeni syndrome. I am repeating, Lee-Fraumeni syndrome. Here, my dear students, you can see the main genes regulating apoptosis and the cancer causing agents. So the gene regulating apoptosis or programmed cell death is prompted by the genes BAX, BAD, BCL, XX and p53, whereas it is inhibited by BCL2. Overexpression of BCL2 is associated with follicular lymphoma. Cancer causing agents. These agents include chemical carcinogens, radiation exposure and the microbial carcinogens. Chemical carcinogens perceived pod demonstrated the increased incidence of scrotal skin cancer in chimney workers exposed to chemical soot. So, for example, the chemical carcinogen benzene can cause associated with cancer, leukemia, Hodgkin's lymphoma, asbestos. It may absolutely cause the lung cancer, mesothelioma. Nitrous can cause the gastric cancer. Naphthalene can cause bladder cancer. Aflatoxin can cause hepatocellular cancer. Vinyl chloride, arsenica, angiosarcoma of liver, polycyclic aromatic hydrocarbons, lung cancer, chromium nickel lung cancer. And with the radiation exposure, you can check out now the different the radiatic waves and what it may cause from it what. So we go to the next topic, multi-step carcinogenesis and its major graph. It is in the cancer like colon cancer, which starts from the normal epithelium, then it goes to hyperproliferative epithelium, then it may lead to the early adenoma, then intermediate adenoma, then it may lead to the late adenoma, then carcinoma. So which are all the normal epithelium was supported by the loss of or mutation of APC of chromosome 5q, and from the adenoma it is supported by the mutation of RAS gene. and the intermediate adenoma was after the intermediate adenoma. The changes was supported by the loss of tumor suppressor gene SMAD2 and 4, and it leads to the loss of P53. So the tumor growth is going progressively, and it starts from the normal cells to the metastasis. Oncogenic viruses. So it is also very important topic about the oncogenic virus, which leads to the tumor the tumor productions. RNA viruses and DNA viruses. The human T-cell leukemia virus, it's the first, HTLV1, and the hepatitis C virus, HCV, which is RNA virus. And in the case of DNA virus, hepatitis B virus, then human herpes virus 8, human papillomavirus, Epstein-Barr virus. These are all oncogenic viruses. So the RNA viruses are related to the leukemia virus and hepatitis C, and the others are related to the DNA viruses, hepatitis B, human herpes virus, human papillomavirus, Epstein-Barr virus. The important points about the Helicobacter pylori is the only known carcinogenic bacteria. It causes maltoma. Please listen. Helicobacter pylori is the only known carcinogenic bacteria is called maltoma. The Cushing syndrome is the most common endocrinopathy. Hypercalcemia is probably the most common paraneoplastic syndrome. Grading and staging of a tumor. Grading of a cancer is based on the degree of differentiation of the tumor cells and the number of mitosis within the tumor as presumed correlates of the neoplasm's aggressiveness. The staging of cancers is based on the size of the primary lesion, its extent of spread of regional lymph nodes, and presence or absence of blood-borne metastasis. And in about the tumor markers, the markers of human chorionic gonadotropin is associated with the cancers like trophoblastic tumors, non-seminomatous testicular tumors. Calcitonin is the tumor markers like associated with the cancer of medullary carcinoma of thyroid. Catecholamine and metabolites, phenochromocystoma and related tumors. Carcinoembryonic antigen. Carcinomas of the colon, pancreas, lung, stomach, and heart, prostate, and the heart. So the alpha fetoprotein, which is the tumor markers which presents in liver cell cancer, non-seminomatous germ cell tumors of the testes. Prostatic acid phosphatase, it leads to the prostate cancer. Neuron-specific analysis, small cell cancer of the lung, neuroblastoma. So my dear students, my dear friends, please note out the tumor markers from this table, and please note it down, and please remember. And in this table we can see the paraneoplastic syndromes and the clinical syndromes, major forms of the underlying cancer, and the causal mechanism. So my dear students, please note it down and please read carefully and repeat it carefully. Please remember this is the major important. Thank you for watching my lecture. Please write your comments and suggestions. Please subscribe to my channel. Thank you. And please write about what are the topics you like to get as a lecture. I can improve my language, I can improve my